Everyone talks about tidal volume and PEEP, but one of the strongest predictors of ventilator mortality is something many people ignore: driving pressure. Driving pressure is the pressure actually stretching the lungs during each breath, not the total pressure on the ventilator screen. The pressure distending the alveoli. And if you don't understand it, you can unintentionally destroy lungs while thinking your settings are protective. The formula is simple. Driving pressure equals plateau pressure minus PEEP. Plateau pressure represents the pressure inside the alveoli after airflow stops. PEEP is the baseline pressure left in the lungs at end expiration. The difference between them is the actual stress applied to lung tissue. Imagine two patients both receiving 450 ml of tidal volume. One has compliant lungs and need only a small pressure change to inflate. The other one has stiff ARDS lungs and requires massive pressure swings. Same tidal volume. Completely different lung injury risk. That is why tidal volume alone is not enough. Our driving pressure below 15 is generally safer. Around 15, mortality rises significantly in ARDS. Once you start reaching 18, 20, 22, the lungs are being overstretched. Alveoli begin opening and collapsing repeatedly, causing ventilator-induced lung injury, inflammation, and worsening oxygenation. Now, here's the important part. High driving pressure means either the lungs are stiff, your tidal volume is too high, or your PEEP strategy is wrong. For example, if plateau pressure is 28 and PEEP is 10, driving pressure is 18, dangerous territory. What do? First, reduce the tidal volume. Smaller breaths reduce alveolar stretch. Second, optimize the PEEP. Not blindingly increase it. Sometimes raising PEEP recreates alveoli and actually lowers the driving pressure. Other times, it overdistends lungs and worsens it. Third, assess compliance. If compliance is terrible, force volume into stiff lungs is harmful. Also remember this, peak pressure is not the same as plateau pressure. Peak pressure includes airway resistance, like secretions, bronchospasm, kinked tube. Plateau pressure reflects alveolar pressure. Driving pressure is calculated using plateau pressure, not peak pressure. Here's the clinical part. A patient can have a normal tidal volume and still die from excessive driving pressure. The ventilator may look calm while the alveoli are being ripped apart breath by breath. Stop staring only at oxygen saturation. Start looking at the pressure actually hitting the lungs.